The Medical School HQ podcast, session number 49. Hello and welcome back to the Medical School HQ podcast. This is the place to learn how to excel as a pre-med student, learn what it takes to survive medical school, and turn your dream of becoming a physician into reality. We're bringing you the most unbiased, up-to-date, and honest information available online today. My name is Ryan Gray, and I am joined by my co-host. I don't have you on the show enough, apparently.
That being me, Allison Gray, your wife. Hello.
Yes, my co-host, Allison Gray.
I help with his grammar, too. It all works.
Yeah, I'm very poor grammar. Anyway, welcome back to the show, to the Medical School HQ podcast. Thank you for joining us again.
Happy Halloween.
If this is your first podcast with us, then thank you for joining us. If you are a returning listener, thank you for coming back. Today, we have a kind of different podcast because we're releasing this the day before Halloween. And so Allison and I were talking about what we should talk about, and we said, let's talk about some of the scariest stuff that we've encountered during our pre-med path and medical school and even beyond, and kind of do a little Halloween theme. So that is what we're going to do for you guys today. And hopefully you get a lot of entertainment out of this one. It's not so much learning, it's more of understanding the kind of stresses and what you go through as a pre-med and medical student and beyond. So before we get started with that, I want to give a quick shout out to the 1 5-star review that was left, and it was actually left from our friends north of the border in Canada by Jimmo87, and I'll leave the A out of it. He should have Jimmo87A, right? A? She's slow. Anyway, Jimmo87 says, excellent info, very well put together. Would be great to have some Canadian content, Canadian pre-med, med school processes, and how it might differ from the American versions. Lots of fans on the colder side of the border. Jimmo87, we definitely will have some Canadian content. I know I have a big interest in reaching out to some of the Canadian medical schools and talking to them. It's very different, a lot more competitive, and I'm sure you've heard us talk about Allison and her pre-med path.
It's my alma mater up there.
Having gone to McGill up in Montreal. Mm-hmm. So we'll have some information for you, Jimmo87. I can't guarantee you when or tell you specifically when, but keep listening and we'll have something for you, hopefully before you finish med school. Before we get started talking about some of the scariest things that we've seen, I want to remind you that you can continue the conversation with us in a couple different ways. You can jump on Twitter and send us a tweet. We are at Medical School HQ. Allison's on Twitter now. You can send a tweet to her. She's at Allison_MSHQ. And you can email us. I'm Ryan at medicalschoolhq.net. Allison is Allison at medicalschoolhq.net. Or you can go to the show notes, which is probably the best way to continue the conversation about this specific episode. And you can go there at medicalschoolhq.net/49 for the episode number. And there you'll get all the show notes and everything else we talk about. And you can leave some comments there and let us know if you've had any scary moments as a pre-med or a medical student. So why don't we get into what we've seen, what has scared us on our path to medicine. The first thing that came into my mind was the MCAT. I think that's the first thing that scares everybody on their pre-med path, and that is the first hurdle. And that's actually studying for, registering for, and taking the MCAT. What do you think about that one?
Yeah, I think the MCAT is very intimidating. And I remember the day of the test going in and getting fingerprinted, and you feel like you're at a police station and you're taking the most intense test of your life that's going to determine your future. And it's just all very stressful, but it all worked out in the end. But yes, very scary at the time.
Yeah. And the other one that I thought of just right off the top of my head is another test, step 1, and I guess step 2, but step 1 more so because it seems to have much more weight for your residency application. So the two that jumped into my head for scary moments during the whole process were tests, and I don't know if that's a good thing or a bad thing.
Well, it's part of being a medical student and a doctor. You end up taking a lot of tests, but those are some pretty big first ones. So it's understandable.
Yeah. And then I think the most of the rest of our lists are firsts during the whole process. So why don't you go through a couple of your firsts that you have listed?
Yeah, there are a lot of firsts in medical school, and I think a lot of the fear comes from those first experiences. When Ryan and I were brainstorming, some of the other things we thought about were some crazy or scary situations with patients, which we'll get into later. But in terms of these firsts, so let's talk about our first day and night on call. That was very nerve-wracking. And I think back to really just my first day of internship, the first day that you actually put on your white coat and as a doctor. And I got up at 3:45 in the morning because I had about a 40-mile commute to work. And I looked in the mirror and I thought, oh my God, I look like death. And this is going to be the rest of my life. What have I gotten myself into? So I wasn't so scared then, just super tired. But then as I drove on the road, every mile I got closer to the hospital, I'm thinking, oh my God, I'm so scared. And we had 4 years of medical school right behind us, and we had lots of experiences with patients. But this was the first day that I'm actually writing MD after my name and where I felt like it was my butt on the line. So I came into the hospital after parking my car and got all my tools and my stethoscope and went into the hospital. And I got sign out from the resident who'd been on the night before. And that's where you get basically a list of all the things that have happened with the patients you're taking. And again, my heart's racing. And then I get up to the floor and I'll never forget this. I'm about to go into the room of one of my first patients to pre-round on him. And that means I'm finding out about... Well, I'm talking to him and examining him before rounds so I can update the team and my attending about everything going on. And I remember hearing his nurse say, oh, don't worry, Mr. So-and-so, your doctor's coming right in just a minute. And I'm thinking, oh my God, I don't know what the hell I'm doing. What am I going to be helpful with?
Yeah.
So it was a scary day, but every day got better. And then you come into your own. But those first days they were scary.
Yeah. And when we were interns, I know it wasn't really true for your specific internship, but for my internship, we had overnight call as interns, which they've done away with now. But you would start in the morning and round on your patients, and then you would work overnight on call. And I remember the first night I was on call and kind of just hanging out all by myself. It's 9, 10 o'clock at night, and it's kind of eerily quiet, and you're wondering if it's the calm before the storm, and you keep wondering if you should try to get some sleep, because that's the first thing they tell you is eat when you can and sleep when you can. And so I crawled into bed, and I think I slept with one eye open the whole night, because when you sleep during residency and even during medical school, if you're taking call as a medical student, it's not really sleep, because you're always waiting. You're always kind of in a hyper aware state where you're waiting for the pager to go off or the phone to ring. So it's interesting, and it's a very scary thought that first time you wake up and what it's even scarier, that thought of missing a page.
Yeah, and
sleeping through it.
I had co-residents who did sleep through a page. That's not a good feeling at all. Fortunately, I never did, but definitely there were many, many times during residency where I had to jump literally out of bed because I woke up to the sound of my pager, saw what it said, and said, oh, expletive, and started running. And it's not, don't think that if you're on overnight as a night float that you're going to get rested sleep. That's not the idea.
Yeah.
But I will, I also remember those first days, those first beginning times. I remember during my orientation as an intern and sitting there nervous. And the program director at my internship, I was at a great hospital, and he said, despite the fact that we were supposedly a great group of doctors, of new doctors, because it was a really good program, a great hospital. But he said to us, in his wisdom, he said, I want you all to realize that you're all sitting here, and some of you are thinking that you're really, that at some point soon, very soon, we're going to find out that you're the phony and that you're really not up for the task, and we're going to find this out about you and realize that, yes, you went to medical school, but you're not cut out for this. And I'm hearing this and I'm like, oh my God. And he's like, remember, that's not true. You're all here for a reason. You've earned this. You're here because you are great doctors. And even though you're new at this, you're going to be fine. And his main message was just breathe and remember to write things down, because that's all you need to do and the rest will follow. And he was right. And I tried to keep his words in my mind as I went through every day, one day at a time, one note at a time, one patient at a time. And it really was true. And nobody turned out to be a big phony. We were all fine.
Yeah. I don't know about myself.
I think you're fine.
Okay, great. Thank you. So the next one, another first, is the first family meeting. I don't know if I specifically remember my first family meeting. I think I remember my own personal life having family meetings for family members, but I don't know if I specifically remember the first time where I was the physician in the room and going into a meeting with a family to give them news of a loved one's current state of health or what was going on. But you remember yours.
I definitely do, and I'll never forget. I have to also say that this is an area that's very near and dear to my heart as a physician. I really, through my years of training and now still as an attending, I've really had experiences that have taught me just how crucial, how essential that family meeting is. We take care of patients as physicians in the hospital and in the clinic all the time, and I think what people fail to realize as doctors and other healthcare providers when you're rushing around, and particularly in residency, is that the family and the patient don't necessarily remember anything about the names of the doctors they meet or the tests they had or what the test results were, but they do. They absolutely do remember those times when you sit down and you talk about what's going on. They remember the way the doctor looked, what they said, and they remember those interactions, which is why one of the things patients complain the most about is not necessarily the outcome of something that happened, but the way they were treated by a doctor, a doctor's bedside manner. And the family meetings are so important. They're not something that's taught. And we'll spend another podcast sometime talking about this because it's so important. But part of why I realized that this was such a crucial part of our work as doctors is out of this first experience I had. So as an intern, it was day 3, and I had recently just accepted this patient out of the ICU. She was extremely sick, very ill, and was sick enough that, or well enough that she didn't need to be in the ICU anymore. But she was extremely sick. And so I was very nervous already inheriting her because I had never really taken care of someone this sick before, even as a medical student with just so many ongoing problems. And I think my attending or my junior resident said to me, okay, well, we need to have a family meeting. The family wants an update about how things are going. And I'm thinking to myself, okay, I'm not even sure I really understand everything going on with her. And now I'm supposed to somehow, in my third day as a doctor, be able to convey in a way that the family will understand what is going on with this woman, what her prognosis is, and what we're doing to try to make her better. And I just remember feeling so overwhelmed at the thought that this was my responsibility to go and do all of this. And I was just petrified. So I turned to my junior resident. This was a few hours later, and it was time for the meeting. And I said, I'm really nervous about this. I don't feel like I'm prepared for this, and I don't want to do a bad job. And bless his heart, I'll never forget him. He's now an awesome cardiology fellow. He said, don't worry, we're going to do this together. And we went over her case, and everything going on. And we went in together. And it was funny. I mean, he did such a great job in explaining so much of it. And I actually did a lot of listening more than talking. But somehow through our interactions at the end of the meeting, the son of the patient got up and gave me a big hug. And I remember the junior resident saying, well, gee, that doesn't seem fair. He was kind of joking later, but it was so important. And so it just stuck with me about what a gift that was to me, because someone had told me a couple hours earlier, okay, you're about to go and have this extremely important family meeting and it's day 3 of your internship, go. And I was peeing my pants, figuratively. And then my junior resident really took me under his wing and showed me the ropes and showed me how it was going to be fine. So, but that stuck with me, and it still has become such a focal point of what I feel so strongly about. That's important as a physician, and end of life care in general is so important in the way that we approach it in families. So not to get off too much on a tangent, but it's just amazing how these first fearful experiences that you have as a doctor and as a medical student as well can really stick with you and define what you feel like is important later on.
No. Well said. And I know you're a big end of life proponent, the end of life care and the family meetings and having a plan and having those discussions. So
absolutely,
that's another podcast discussion. So I want to talk about the first that was scary for me, and that was the first time as a gen surge medical student rotating in general surgery and being in the emergency room waiting for trauma patients to come in. And where we went to medical school, we had a very large level 1 trauma center. And so waiting for those calls and getting those calls and saying, okay, we have a patient on the way, and sitting in the trauma bay all gowned up, ready to go, I think can lead to some PTSD for some, because you're just sitting there. The whole team is just sitting there waiting for the patient. And that's scary because everybody has a defined role on a trauma team. And you're the med student, and you really don't have a role as the medical student other than to stay out of everybody else's way.
I was just going to say that's got to be it.
Yeah. And that's a scary moment, because at some point I did jump in and I did help, and I helped move the patient or help stabilize something that was flopping around or whatever I did. But I vividly remember just standing in the corner all gowned up with my universal precautions and gloves and gown and everything, and seeing the kind of awesome event that was going on around me, but being scared that I was going to mess something up.
Yeah, those are really nerve-wracking situations. They're very protocol-based and very algorithmic, but as a medical student, when you haven't done this a whole bunch of times, again, it's a first. It's sort of that, oh God, I hope I don't get in the way. I just want to be helpful. I just want to learn. And it's funny that I think about being in the OR for the first time. And again, it's that feeling of, okay, you just want to stay out of the way, but you also want to be getting involved as much as you can, get your hands dirty, learn. And I, as some of you may know from earlier discussions, I tend to be a little on the clumsy side, which Ryan likes to make fun of. And so in the OR, I was terrified that I was going to drop something and ruin the sterile field or compromise it somehow. And the first thing you have to do after you scrub up, scrub up, right? It's been so long. Oh my God. Scrub in, obviously. But I'm thinking of when you clean your hands for like 10 minutes.
Nobody scrubs anymore. They just rub the lotion all over themselves.
Right, which seems cool. Like crazy. We used to spend like 10 minutes standing there with that pink stuff up and down every crevice. But in your hands, that is. But anyhow, so you clean your hands, you go in the room, and you can't touch anything. You have to turn around. It's like a whole dance. And the scrub nurse was there, and you just have to do everything just so, because she's going to hand you your gloves, and you have to make sure you're toweled off appropriately. Anyway, I was just so nervous, and it took me like 4 or 5 times to really get down, what I was supposed to do without feeling like I was a complete wreck. So it all worked out, and I definitely got a ton of time in the OR during medical school, but it's funny what things will make you nervous.
Yeah. So what about the first time you got that acute stroke call?
The acute stroke pager. So during my residency, we would hold the infamous pager for the ER, and the ER pager would cover any acute stroke that came in through the emergency room doors. And sometimes you'd get a heads up that this person was coming, and sometimes they would just roll in and you get a page and you need to be downstairs. And the reason that it is scary is because the clock is ticking. It's like when someone comes in with really bad chest pain and they could be having a heart attack. As they say in neurology, time is brain. And for every second that you're there, neurons are dying. And so it's funny because the first time actually an acute stroke was called on my watch, it turned out to be someone who wasn't having an acute stroke at all. But I raced down there and it's a stressful situation. You have to quickly get as much history as you can, but then jump right into a stroke scale, which is an exam that's very algorithmic and counts up the number of points that someone has to help determine what's going on and how big, how extensive this potential stroke is. So there was a fellow who showed up too, a neurocritical care fellow, to help guide me through. But yeah, that was a lot of responsibility. I think in some ways, a lot of the first experiences that I had that were really scary and anxiety provoking were actually more as a junior resident in my PGY 2-year of residency, and probably just because that responsibility was ramped up that much more than when I was an intern. I felt like in my internship there was just a lot, even more supervision, and I wasn't quite out there on my own as much. But as a junior resident, while you of course had senior residents and attendings and fellows, there were definitely some times when it was really you, and it felt like more scary because of that. But you get the hang of it, like with anything. And my God, I lost count of how many acute strokes I responded to as a resident. So practice makes perfect, as they say. And you do a lot of practice as a resident. That's how you get good.
Yeah, lots of practice. So let's talk about some different scary. And by different scary, I mean patient-wise. And I think I'll start with one of the experiences that I remember as medical students, where we were actually together for this one, going down into Manhattan, into a locked psych ward. That was scary. Walking inside that door and having that door locked behind you and knowing that you're on a psych ward, not knowing why the patients are there, and kind of vulnerable. And
we did go together that day. I forgot about that day.
Yeah, who's got the good memory now? Yeah, and so that was interesting. You look at pencils differently. You look at everything a little bit differently because everything. I mean, I don't like the stereotype, but anything could be turned into a weapon, and you don't know. You just are on the edge.
Yeah, you're out there, and for the first time, you're in this very just alarming situation where there are locked doors and there are certain people that are not allowed out, and now you're with them. So it's not a typical situation that you would find yourself in unless you work at a prison or you're visiting someone who's a prisoner or you're in medical school.
Yeah, and that's interesting because my internship was done at a prison hospital, and so that became old hat to me, going into a locked ward where you're actually walking inside a prison and treating patients inside prison cells, basically. And that can be scary. We had several patients that I knew why they were there. And unfortunately, you're not really supposed to. And I preferred not to know why patients were in jail. But it can be scary going into a room alone with somebody if you know that they might have been a violent offender and they're there. And we had several patients that they like to eat things for some reason. They like to swallow weird objects like pencils. And one guy, I think, got mad at the Bruins game, and so he broke the TV and ate all the glass. And it's interesting moments, but can be very scary because you're in there alone with the prisoners, like locked in a psych ward with patients that might not be completely stable. So those are some scary moments for me.
Yeah, I think it's particularly challenging when you first encounter patients who are very sick in a psychiatric way, because when someone's very physically ill, they may be very sick, but there's not, it's sort of out there what's going on and why they're sick. With someone who has a psychiatric illness, you may know that they're schizophrenic, but you really don't know what's going on in their head unless they're talking with you. Even then, it's just not the same. And so you really don't know necessarily also how to interact with them in the same way. If someone is physically ill, you want to obviously try to help them and make their physical illness better. But it's hard when you don't have any experience. If you're not a trained psychiatrist or trained psychologist, you don't know how to even communicate sometimes with someone who is psychiatrically ill because you don't even speak the same language in a way. So I had similar, I think it was scary being on the psych ward as a third-year med student when patients would become extremely delusional or just completely violent even and out of control, and they'd have to be held down and sedated. And that's a hard thing to see for the first time. It's definitely, it's troubling. And I remember a friend of mine in med school or someone I was working with, we watched this happen one day and she said, "Oh my God, I know I'm not going to be a psychiatrist." And all of the psychiatrists out there, I mean, it's a very, it's a difficult job that they do, but it's an important one. And so everybody gets scared about different things. Certain people don't like blood. Certain people don't like other things.
Yeah. What about some scary patients that you've had?
As an intern, I think one of the scariest things I saw, and some of my memories, I have to say, were sad. I think when I think back on what were quote unquote my scariest memories or crazy scary patients, I think about things that were actually really sad that scared me on a deeper level, I think. That were disturbing. And one of them, there was a 40-something-year-old guy, such a nice guy who came into the hospital and seemed to have a bit of pneumonia, seemed to be not feeling well, had gone to another hospital, and they found an absurdly high number of white blood cells in his blood. And some of them were very abnormal looking, meaning that they looked cancerous. He was in what we call a blastic crisis. And he was transferred to our hospital. And again, he was sick, but he didn't look any worse than anybody who's ever had the flu. And he was ultimately diagnosed with AML, which is a terrible form of leukemia. And ultimately, he died within 48 hours. And we threw the kitchen sink at this man, and we tried to do everything we could to cure him, to not even to cure him, just to stabilize him. But he very quickly he was transferred to the ICU, and literally within 48 hours, he was dead. And it was so alarming to me as an intern at that time that, my God, you learn about leukemia in medical school, you read about it. But to actually see this disease just rip the life away of this young 48-year-old person or 40-something-year-old person who was engaged to be married, it was just terrifying. It really scared me. And I thought, my God, I have a lot of respect for this disease. So that never left me.
Yeah. I think we could kind of go down the list and talk about all the scary patients, but there's a lot. And
it's probably also disturbing if you haven't kind of gotten your hands dirty and gotten in there. It can be scary to hear about these things. So, but at some point, you'll have your share of the things that stick with you, and that's why a lot of doctors now tend to write down their memories, their experiences with patients. And sometimes they're funny and sometimes they're scary, but it's great to keep a journal of what you encounter as a pre-med if you're out there doing your clinical experiences, because again, they're stories you can draw from and take with you for years and even talk about in your interviews or in your personal statement. But later too, as a doctor, even when you're super busy, I always said, God, it would be really great to write all this down. And I've just kind of kept a mental log of it, but it's amazing what sticks with you over the years.
Yeah. So that's our Halloween edition podcast. I hope we didn't bore you with some of our going back and talking about what scared us but I think overall the path to being a physician is generally pretty scary. There's a lot of hurdles, a lot of unknown, a lot of hard work that you don't know as a pre-med if it's going to pay off, because medical school is pretty selective. But at the end of the day, it always comes down to one thing, and that's great patient care. And at the end of the day, that's always worth the journey.
It is. And I think I always remind myself along the way that as you're going through medical school or the pre-med process and then medical school, you're going through it with a group of other people. If you're a non-trad and you're out there kind of on your own, that can be a little different. But for the most part, once you're involved heavily in this process, and certainly once you're a medical student, you're surrounded by a group of other people who are going through it with you. And that in and of itself is very comforting because you can share your experiences and talk through some of the hard stuff. And yes, it's scary, but it's the most worthwhile journey you'll ever take.
So we hope you have a happy and safe Halloween this 2013. If you have any scary situations that you've been in as a pre-med or maybe some shadowing experiences or as a medical student, let us know. Go to medicalschoolhq.net/49 and leave a comment and let us know what you think. And I think that's it. I hope you join us next time here at the Medical School headquarters.